Hello everyone. Today we are going to be discussing a cardiovascular disorder called tachycardia, which is actually a type of arrhythmia that creates fast, irregular heartbeats in the human body. To understand how tachycardia works, we need to know the proper physiology of a healthy heart. To start off, we need to know what the anatomy of the heart is. So the heart actually has 4 chambers. There are 2 upper chambers known as the right atria and the left atria. And then we have 2 lower chambers known as the right ventricle and the left ventricle. Now, to begin this process, we start on the inside of the upper chamber in the right atrium, and there are a group of cells called sinus nodes. And these cells actually create the electrical signals to make the heartbeat. Then those signals will transport across the upper chamber to the left atria, where there will be a group of cells called atrioventricular nodes. And these cells actually slow that electrical signal down before they go into the lower portion or lower chamber, which are the ventricles, to then create that process. Now, in a healthy heart, all this electrical current process goes very smoothly, creating a resting heart rate of 60 to 100 beats per minute. Now, in a tachycardia situation, there can be a specific cause that creates that heart to beat faster than 100 beats per minute. With tachycardia disorder, sometimes the causes are unknown. However, the most common causes are fever, too much caffeine, stress, lack of sleep, imbalance of electrolytes, smoking and nicotine use, excessive alcohol use, which is calculated as 14 or more drinks per week, high or low blood pressure, and overactive thyroid. This creates symptoms such as racing and pounding heartbeat in your chest, which creates that flutter feeling, chest pain, shortness of breath, lightheadedness, and a high pulse rate. Now, think of this as when a normal, healthy heart, after someone is running and it starts pounding and fluttering, this is how a tachycardia patient feels 24/7. So to be able to treat this issue, we use medications such as beta blockers or calcium channel blockers. If these medications don't work, then a pacemaker can be implemented into the program to see if that will help this tachycardia patient. I hope you were able to learn something today about this disorder. Thank you.